Hello, my name is Francie Bernier, and today I'm going to review the use of the Hollister Microgyn Plus Pelvic Floor Stimulation Unit. Urinary incontinence is defined as the involuntary loss of urine. There are three types of urinary incontinence: urge, stress, and mixed incontinence. Urinary incontinence can be caused by a number of things, including childbirth, surgery, menopause, medications, or genetics. Urge incontinence, often called an overactive bladder, is a result of a bladder in spasm. Although the exact cause is unknown, symptoms include the sudden urge to urinate with or without urine loss. These symptoms may occur in the daytime and/or nighttime. Sometimes the symptoms may be associated with certain events such as putting the key in the door or turning on the water faucet. Stress incontinence is the loss of urine that occurs when there is increased pressure on the bladder. This type of incontinence usually occurs during coughing, sneezing, laughing, or when lifting or walking. In most cases, the symptoms are present during the daytime. The cause of this type of incontinence is related to weakened supportive muscles surrounding the bladder. Some patients will have symptoms of stress incontinence and urge incontinence. This condition is called mixed incontinence. The Microgyn Plus can be used to treat stress, urge, and mixed incontinence. This unit uses electrical stimulation to cause a painless contraction of the pelvic floor muscle. Repeated contractions increase the strength of the supporting muscle, thus decreasing the symptoms of stress incontinence. For urge incontinence, the squeezing of the pelvic floor muscle relaxes the spasming bladder, eliminating urgency, frequency, and urine loss. Your physician has determined that you are a candidate for treatment with the Microgyn Plus Pelvic Floor Stimulation Unit. However, do not use this product if you have one or more of the following conditions: a copper IUD in place, a history of an active pelvic malignancy, if you have a pacemaker or any other implanted device, if you are pregnant or attempting a pregnancy, if you have reduced cognitive ability, or Alzheimer's or dementia. You will be able to use your Microgyn Plus in the comfort of your home. Written instructions are included with the unit. Following is a brief explanation of the use of the home stimulation unit. Your Microgyn Plus will come with a sensor for insertion into the vagina or the anus. It is powered by a 9-volt battery. A conductivity gel is necessary to deliver the stimulation. Settings on the unit are specific to your condition. Your caregiver will program the appropriate settings, teach you how to place the sensor, and discuss the frequency of your home sessions. Once your Microgyn Plus unit has been properly programmed, you are ready to begin your stimulation session. Before beginning any session, make sure that the slide control is in the off position. Place a small amount of the Hollister gel on the sensor. When placing the sensor, make sure the silver rings are just inside the anus or vagina. It is important that the sensor is not inserted too far because correct placement allows for the direct stimulation of the pelvic muscle. Your clinician will answer any questions you may have on sensor placement. Insert the sensor and attach it to the appropriate plug or cable adapter on your Microgyn Plus. After you have inserted your sensor and attached it to the Microgyn Plus unit, get in a comfortable position. Turn on your Microgyn Plus by slightly moving the slide control on the front of the unit. Gradually increase the intensity level of your unit by moving the slide control to the right. You will note the numbers 0 to 10 on the scale. This device is made to gently stimulate or contract the pelvic floor muscles. The muscles get stronger as they contract over and over again. Just like any exercise program, muscle strength increases over time. During stimulation cycles, you will feel a tingling sensation in your pelvic floor area. The unit is programmed to stimulate, then rest your muscle. Increase the intensity very slowly until you reach a level that causes a contracting or moving sensation in your pelvic floor. Although this will feel strange, it should not feel painful. Again, increase in very small increments. The sensation that you should feel has been described as a fluttery, pulling or tightening, or swelling sensation. If you are experiencing pain, reduce the intensity level. If the pain persists, contact your caregiver. Once you have reached a level of intensity in which you feel the muscle movement but not pain, you may relax and let the unit do the work. After 20 minutes, the unit will stop automatically. When the unit stops stimulating, return the slide control to 0 and remove your sensor. Wash the sensor with soapy water, dry it completely, and store it in a clean, safe area along with your unit. Remember, it may take time to build strength in these muscles. Increased muscle strength leading to decreased symptoms may take several weeks. Improvement can be experienced quickly for some people, while it may be at a slower pace for others. Your caregiver may add other components to your treatment plan. These may include recording your bladder habits, a home exercise plan, or a dietary and fluid management plan. Talk to your caregiver about these and any other issues that you think may affect your improvement. At Hollister, we know incontinence impacts your quality of life. If you have any questions about Hollister products, please visit our website at www.hollister.com. Hollister is glad to be your partner in helping you improve your quality of life.